I was working in the ICU, and I had a combative patient, which is the norm in the ICU. ICU psychosis is an everyday thing there. So I was placing an IV. Everything went fine. I was applying digital pressure, and as I unhooked the chamber, the patient pulled her arm away. So the blood that was left in the hub went straight across my face and into my eye. This was just a few drops, not anything that you would normally even think about. But the day before, I'd had LASIK surgery. And so even though I'd had the note from the doctor to go back and that I'd been cleared from my physician, the incision in my eye wasn't healed. So the blood went straight across my face and into my eye, and this was a patient who was HIV positive and had a high viral load, Hep C positive as well. I had to go down to the ER. They drew my blood, and because I had just had the surgery and because the patient's history, they placed me on antivirals for 3 months. I've never been so sick, ever. I was on every antiemetic that could come by. I still missed 15 days of work. But the worst thing was when I had to go home that night and tell my husband that our relationship would change, because now we had to think about protection for the first time in our marriage. I had to tell my children that there was some danger that I could have been exposed. So, from going forward from there, in following 6 months, I got tested again, and that came back negative, and so far I'm fine. But in those first 6 months, every time I got a cold, or every time that I had a few muscle aches, I thought, well, is this it? Is this how it starts? So now I get tested once a year, and I have to tell every new physician that I go to that I have this history and why, and I think about it all the time. So not only did I put myself in danger just by being a nurse, just by doing the regular, normal, everyday things that we do, nothing special. I wasn't careless. I didn't do anything wrong. The product that we had did not fail me. The patient didn't do anything wrong. She was just doing what patients do, which is moving. But that day, at that time, with that patient, I was put in danger. And because of that, I put my family in danger. So now I think about that all the time. I think about it every time that I start an IV. I think about, is this the best product that I could be using? Am I as most prepared as I could be? Do I need another set of hands? Do I need someone to come help me? And so my advice to a new nurse would be to make sure that you have the products that you need that are up to standard and are the best that the hospital can give you. And if it's not, then go to those people who can help you to make that change. Go to your value analysis committee, or go to your educators, or your nursing supervisors, or even your CEO. Send an email. Ask them to come down and take a look at the floor and see what it's like to put in an IV. See what the blood exposure really is. Tell them your stories. I know that every nurse I've ever met has a story about blood exposure.